New Mexico Hospital Association has been working to reduce their total patient harm rate.
My name is Carlene Brown, and I am the HIN Hospital Engagement Network Advisor for the state of New Mexico. In our state, to eliminate patient harm, we are most proud of the involvement that our hospitals have had in this project, their willingness to look at their data, to monitor their harms, and to make rapid cycle improvements. In the past, we have always looked at individual metrics and measures and worked on those. This was a new thing for our hospitals, and they really embraced the idea that total harm was what their real goal was, and it changed the nature of how they looked at their systems rather than their individual processes and areas. It's a big change for a hospital to look at things from a system perspective because they're often fragmented and not communicating across lines, so that is where the gaps that cause patient harm occur. I think that one of the focus areas that we've had in our state has been early elective deliveries, and before this project started, we had not even looked at that. We had no collaborative, we had no group of leaders coming together to look at early elective deliveries or basically anything that had to do with OB harm. With this project, I think we have rallied our OB leadership in our state and our ACOG and others to actually begin to look at these things, and they have really embraced this and have really begun to go forward with our hospitals in it. So one of the areas that has been most beneficial to us has been the ability to send frontline staff and managers and leaders from the hospitals to these national meetings and improvement leader fellowship opportunities to share and to learn with others. And they are very hungry for those opportunities, and they learn a lot, and that's just been like gold for us in our state to be able to participate at that level. New Mexico is one of the top performing states in the HRET HIN group. And the reason that we're top performing is not because of what the Hospital Association necessarily has accomplished, because we don't treat the patients and we're not frontline on the patient harm. It's the hospitals themselves who have come forward and said, this is what we want to do and this is how we want to be seen with our patients as preventing patient harm. And they're the ones that have done the work. They're the ones that have gotten us to be top performing state.